Hi, my name's Erica and this is Christian. Thank you for the opportunity to talk about rare disease. I advocate for Christian who has Ohtahara Syndrome. It is a rare disease that affects about 250 kids in the whole world. It's primarily a seizure disorder that has cognitive and developmental global delay. He also has a second component of rare disease called KCNQ2 gene mutation. It's a non-inherited de novo gene mutation, which compounds the seizure problem. For Christian, what motivates me to be an advocate is to give him a better quality of life. His diagnosis is life-limiting. According to the small data that they have on his rare disease, the life expectancy is about 2 years of age. He is 2.5, and so I think what a rare disease life-limiting diagnosis does is that it prevents the healthcare community and the community at large from seeking further options for these kids in particular. So looking to develop drugs for these kids, looking to develop opportunities and therapies for these kids to have a better quality of life. So I advocate to change the trajectory and the connotation of what a life-limiting rare disease means for a child. And what success ultimately would look like for me is a pediatric palliative care center that could offer Christian amazing opportunities for quality of life, as well as our family, as he is one of 5 siblings. Pediatric palliative care is very hard to come by, at least in our state, but my experience is it's similar in other states as well. How have I grown as a rare disease advocate? Well, I certainly have grown quite a bit. I took on GlaxoSmithKline when they wanted to pull a very specific drug that they made for his specific condition. They still ended up discontinuing it due to low profits, but I was able to secure a commitment from them for 2 years of a drug supply. Yeah, you're okay. What can be done to get more people involved is to spread awareness. So whether it means, writing, speaking, doing a video like this, having different opportunities, wherever I go, if it's to a hospital, for him to get his G-tube changed, I say to the radiologist, hey, do you know about Ohtahara Syndrome? And they say no. And I go about educating a lot of physicians and nurses and healthcare professionals on his disease. The key issues facing rare disease community, there's just not enough advocacy. There's not enough known about rare disease, and that needs to change. Based on my experience, what advice do I have for new advocates? Is to not give up. I think, at first when you find out your child has a rare disease, there's definitely a grieving period, and then there's a turning point where you just have to take hold and move forward, because you realize that you know more about the disease than anyone else, and it's your job and your role to educate others. So, thank you so much for giving Christian and I this opportunity to talk a little bit about advocacy and Ohtahara Syndrome, and I hope to see pediatric palliative care really take hold so that kids like Christian can have improved quality of life. Thanks.